The study that was done as part of the American Academy of Ophthalmology presentation was a sub-analysis of the View 1 and View 2 studies. And in the trial, what they did was they actually looked at patients in that loading period and looked to see what effect that fluid had on final visual outcomes in the patients. And what they found were two very important things. First, that the drying effect really affected some quality of life scores. So for the patients, the inability to drive or some other quality of life issues that patients face beyond vision was evaluated and found to be statistically significant in those patients who were drier at the end of the loading period versus those who were not. In addition, what they found was that if in that loading period you develop persistent fluid, that had some detriment on long-term visual outcome. And in particular, it was the patients who had intraretinal fluid who had a detriment in long-term visual outcomes. It wasn't just the total amount of fluid or the subretinal fluid, but particularly the intraretinal fluid that was there. Now, this is the third trial to show intraretinal fluid correlation with long-term visual acuity impact. And I think that's an important finding for clinicians to take home, because if you don't see a resolution of intraretinal fluid early in the treatment, you should be concerned and you should consider potentially switching therapies to an agent that would do it so that you don't lose or keep vision on lose vision on the table.